Assalamu alaikum everyone. Today we are going to discuss effect of depressants and stimulants on frog heart and how to find an unknown drug. We'll test 4 drugs: adrenaline, acetylcholine, atropine and propranolol. I'll explain what each drug is, which receptors it acts on and why it speeds up or slows down the heart rate, and shows the apparatus run the experiment and interpret the results in this practical. So first of all, let's discuss about the depressants and stimulants of heart. The stimulants include adrenaline and atropine. Adrenaline is an agonist at adrenergic receptors, especially beta 1, at low moderate doses. Its stimulate effect on heart means it increase heart rate and increase contractility. It has both positive chronotropic effect and inotropic effect. Next stimulant is atropine. Atropine is muscarinic antagonist. It prevents acetylcholine's slowing effect and therefore increases heart rate. And the depressants include acetylcholine and propranolol. Acetylcholine is muscarinic agonist that acts on M2 receptors. It depresses the effect on heart rate. And propranolol is a non-selective beta blocker. It blocks sympathetic beta 1 effect, means it depresses the effect on heart rate. So the stimulants are adrenaline and atropine, and depressants are acetylcholine and propranolol. Adrenaline and propranolol act on beta receptor, and atropine and acetylcholine act on muscarinic receptors. For this experiment, the apparatus we need includes frog, a ringer solution, kymograph with recording drum, and complete setup for frog heart perfusion, drugs which include stimulants and depressants, syringes, glass beakers, dropper, stopwatch. First of all, wash the frog's heart with ringer solution. Make sure heart is beating properly and record the baseline of heart rate by counting beats for 1 full minute or for 30 seconds, depending on your time limit. We can calculate force of contraction by height of contraction and rate by number of beats per minute. After taking the normal contractions for 30 seconds, now inject 0.5 cc of unknown drug and record the contractions. You will see there will be an increase in the force of contractions as well as number of beats. Wait for 2 minutes and then again take the normal contractions. While waiting for this to complete, we'll talk about the effect of drugs. First, remember that the heart is mainly controlled by autonomic nervous system. There are two sides, sympathetic system and parasympathetic system. Sympathetic system increases heart rate and works through beta 1 adrenergic receptor, and parasympathetic system decreases heart rate and it works through M2 muscarinic receptor. And the drugs we are using includes adrenaline and atropine. Adrenaline act on beta 1 receptor, so it is stimulant, and atropine blocks muscarinic receptors. It prevents acetylcholine from slowing the heart rate, so heart rate decreases and it behaves like stimulant. After adding an unknown drug, we can see there is an increase in the number of beats and height. So there is increased heart rate and increased force of contraction. It has both positive chronotropic and inotropic effects. After this, wash the heart with ringer solution and wait for 2 minutes and then again take the normal contractions. Now we'll again run the kymograph to take the baseline for 30 seconds. Keep in mind that washing is extremely important because it removes the earlier drug, prevents mixing of two drugs, helps the heart return to baseline rate, and makes the effect of next drug clear and pure. After this, switch off the kymograph so the drums stop recording and we can prepare for the next step. In next step, now add 0.5 cc of propranolol. Propranolol is non-drug provided to us, and take the contractions for 30 seconds After taking contractions, immediately add 0.5 cc of unknown drug that we have already added in very first step and record the response. We perform this step without washing because we want to know the unknown drug. We can see that the heart rate is decreasing after adding the propranolol, which is depressant. So the unknown drug must be adrenaline. Compare the difference of adrenaline, contractions and number of beats before and after adding the blocker. Wait for 10 minutes and repeat the experiment in the same way with acetylcholine and atropine. The heart rate decreases after adding adrenaline because adrenaline needs beta 1 to increase heart rate. But these beta receptors are already blocked by propranolol, so adrenaline cannot work. That's why heart rate is decreased. First of all, I added the unknown drug to the isolated frog heart and I observed that the heart rate increased. This suggested that the drug must be sympathetomimetic agent or stimulant like adrenaline or atropine. To confirm, I washed the heart with Ringer solution and then added propranolol, which is a non-selective beta blocker, and this drug is provided to me. Propranolol blocks beta 1 receptor of heart. Without washing the propranolol out, I added adrenaline again. Now, I compared the effect of adrenaline before and after propranolol. Before propranolol, adrenaline produced a clear increase in heart rate and contraction force. After propranolol, the effect of adrenaline was markedly reduced because its beta receptors were already blocked, so heart rate did not rise the way it did previously. This reduction in adrenaline's effect confirms that the unknown drug was also acting on beta receptors, meaning the unknown drug was most likely adrenaline. What happens if unknown drug is atropine, not adrenaline? Then atropine's effect is not blocked by propranolol because atropine works on muscarinic receptors and propranolol works on beta receptors.